I could go on my soapbox all day about this. These are prescription medications we are injecting into your body that are there for extended periods of time. Think about it. Ask questions. Don't rush into it. Be comfortable with your provider. Be comfortable that you can be honest with them, but you can also be open to their honest opinions, recommendations. Then it's going to be great. But if price is your number one concern, I would be concerned as to your level of education and awareness of these treatments.
Welcome to the Dangerous Women podcast, where the intersection of fierceness and femininity fuels empowerment. Our goal is to provide women with insights to unleash their power. Grounded in the 7 principles of self-confidence, we guide women to embrace their duality, delicate as a flower, yet powerful as a bomb. I'm your host, Colleen Conlon, inviting you to join me as we explore topics on health and wellness, empowering you to embody the essence of your dangerous woman. Today on the Dangerous Woman podcast, I am bringing a super special guest who has already been on the podcast talking about her journey with kettlebells, who is also a registered nurse with 18 years of experience practicing aesthetic medicine. And that's what we're going to dive into today. Cosmetic medicine. Welcome, Jolene. The hot topic that is cosmetic medicine is something that I want to bring to your attention today. So this is something where I think people fall into one of two camps. They either support it or they don't. And there's definitely some people who fall into the in-between. Now, on the episode today, I'm going to be bringing on nurse practitioner and medical injector Jolene, so she can give us some more information and insight on this topic from the professional's point of view. Jolene, what procedures fall into the category of cosmetic medicine?
The 2 most common would be neurotoxin injections, and that would be your Botox injections, Dysport, Xeomin, Jeuveau, Daxi. Those are all neurotoxins, and they all relax muscles for a period of, let's say, 3 to 4 months. The difference is they're made by different pharmaceutical companies. So it's often we say, oh, I'm going for a Botox treatment. That's just a very generic saying, but there are different types of Botox, of neurotoxins on the market. So that's, I would say, probably the most common. And then there would be fillers. So a filler can be semi-permanent, it can be a little bit more permanent. So typically we're talking about hyaluronic acid products. Hyaluronic acid is a sugar molecule we all have in our bodies, so it's very compatible with our bodies. So fillers plump, or they smooth lines. So if I'm explaining these treatments to someone brand new coming into my office, I say, typically we use Botox injections in the upper part of our face where we're wanting to treat muscle, to relax muscle, to refresh, give us a little more awake appearance. Fillers are technically, cheek down, where we're wanting to plump, give back volume to the face. That being said, it's much more complicated than I just explain. But if someone is brand new, I think that's a pretty fair explanation. Then maybe we are talking about lasers or energy devices like microneedling, skin tightening, resurfacing, treating acne scars, pigment, rosacea, hair removal. And then a new area that we're kind of seeing is regenerative medicine. So peptides, hormone replacement therapy, weight loss medications. That's kind of the new thing that seems really exciting. Yeah.
So there's a lot of stuff that falls under this category that I don't
Yeah.
know everybody would actually recognize.
Yeah, I would agree. Yeah.
When you have a new patient coming to the office, do they typically just think like Botox and filler, or are they aware of the other things for majority of new people that you see?
They might be aware of them, but it's definitely Botox and filler. And at a very, most people are at like a very beginner level, that maybe that what brings them in is, the 11 lines or our frown lines, forehead lines, very common on women, a little bit of lip filler. And so then when we get into their what the concern that's brought them in that day, it can become so much more involved and complicated than someone thinking, oh, I'm just going to go in and it's just going to be a simple little treatment. And sometimes it is, but there's so much more to the picture than treating one little area with a few little injections.
Is it accurate to say that going in to get work done from somebody like you, it's like you can't just take a taste. Like you might come in thinking you're gonna take a taste, but you end up like walking out with like a whole meal.
Yeah, I love when people say to me, wow, I had no idea. No one's ever explained this to me. Or you were so informative. You really answered all my questions. Wow, this is just, really great what I learned today. I love when people make those comments, because it is something that you really should educate yourself going into, think about. It is not like going to get, our highlights done or our quick little teeth whitened. It's, as much as it is beauty and aesthetics, there is a huge these are medical treatments, these are prescription medications that we're injecting that stay in our body for, periods of time. So it's a really neat area. That what I like is that I can be artistic in my job, how I look at someone's face, talk about the plan, but it's also very much science based and medical. It's such a neat balance that I think most people injecting would say I can use my nursing education and then be an artist and be creative also with what I do.
Can you give us a little bit of background on that topic in particular? What kind of training, what kind of certifications do professionals in this line of work have behind them for the consumer to be aware of?
So typically it would be physicians, physician assistants, nurse practitioners, registered nurses that are licensed to provide these treatments. In some areas, dentists and naturopaths can, but each region is very different. So each region has different requirements based on their professional licensing body. So let's say registered nurse in the state of California may have different licensing requirements than a registered nurse in North Carolina or Florida. So generally, it can be a 1-day course for someone to be certified. And that seems like it is too simple, but it can be as short as that, or it can be a months-long mentorship program to become certified. So each region is very different on what they require. Then once someone is trained, licensed, they have the go ahead, they're safe to go and provide these treatments, then also their licensing body may require yearly continuing medical education credits. Some don't. So it's very different depending on what region someone is in.
And do you find for somebody who's considering finding a professional to perform these types of procedures on them that there's specific credentials you would encourage somebody to look for? Is this something where, you would actually trust the person who just did that 1 day certification, given the additional experience they have in the medical field? Or is this something where it's like, no, I want somebody who has done this for at least a number of years?
Yeah, that's a really good question. I think that is really tricky for people who, I mean, most people, this isn't your job to know. You're going into this to get more information. You're putting a lot of trust in whoever you choose to provide your treatment. So it can be really tricky. So definitely, I would ask, what are your qualifications? How long have you been doing these specific treatments? So let's say someone is a physician and they've been a physician for 25 years. How long have they specifically been injecting and offering these treatments? Not doing other things in their job, which all bring experience and credentials and knowledge to the table. But how many times have you done this specific treatment?
Mm.
I think that's a really good question.
I think it's tricky. I run into this even as a fitness professional, just because one person has been doing it for 10 years and maybe somebody else has only been doing it for 5,
Yeah.
you would think, okay, I want to go with the 10-year person. But sometimes it's not just about how long I've been doing it, it's about how frequently I'm doing it, or the additional experience I have. Maybe I'm also doing it like on myself. It's the results that you're getting. It's kind of like a wishy-washy thing. So I have not had Botox or filler done, but I have had laser hair removal done. And I've had practitioners working on me who, they've been doing it for a number of years. They even do it to themselves. And I'm just like, okay, I trust you. And then recently I had an encounter with somebody who has only tried the treatment on themselves one time, and it's like their first month, and I'm in my head, I'm just like, okay, I understand, like, you might not need to have been doing this for a number of years, but I feel so much more comfortable with somebody who has been doing it longer than somebody who's brand new. Is that the right way or the wrong way to necessarily look at the different stuff that falls under cosmetic medicine?
I think if someone is fairly new, I would hope they're practicing, very safely, or very, maybe a little more on the conservative side. So staying within their limits. And that's always, a great thing, with laser hair removal. Maybe she's staying more within, settings that she feels very safe and comfortable with. And so that's great for the patient. That helps us stay safe. But like anything, the more times you do a treatment, the more times you see someone come back for a follow-up, the more, yeah, just the more people you it's hard to beat experience, right?
Yeah, I totally agree with that. I mean, I see that even like in training all of the time. And, I think of, me and my husband, Tim, for example, we both train. He technically has a lot longer a time frame in this space than I do. But at the same time, I spend significantly more time working with people with the kettlebell than he does. It's not always a matter of the length of time you've been in it, but how close are you to that one thing that you practice again and again?
Yeah, that's a really good point. There's also benefit in, does someone specialize? So I listed many procedures that fall into cosmetic medicine. I focus in just injections. I don't, you know, I don't do laser treatments. I don't do microneedling. I used to, but then I decided, no, I'm going to focus specifically in injections. And that is my passion. That's, all I read about, learn about, immerse myself. And there's that, benefit too.
Well, in that case, let's dive in a little bit more to injections. So the women, actually, I don't know, do men come for injections as well?
Mostly women, but
Okay.
yes, men are, I definitely we see men,
Okay. Okay.
typically women.
So for the people who are coming to get injections done by you, what would you say are three diverse reasons as to why somebody is coming in for this procedure?
Like lines and wrinkles on the face. So, frown lines, forehead lines, crow's feet, those are very common. One of the most common things are tear troughs. That brings a ton of people in, which is more a filler treatment. And that's, not as simple as just putting some filler in our tear trough. It's quite an advanced, involved treatment, but I would say that's very common. Lip filler has always been very common, still is very popular. Yeah, I would say lines, wrinkles, and then volume replacement on the face.
And why do they come for this? If we dig a little bit deeper, is there anything that you are aware of behind the scenes that maybe somebody isn't just sharing on their social media account? Like, why is somebody really coming to get this stuff done?
Yeah, I love listening. So as soon as someone sits in my chair, like even before, as we're walking from the waiting room and bring him into my office, I sit him down. I'm listening to everything they say. So often I'll hear, maybe someone's in their mid 30s and their main concern, what's brought them in that day, is forehead lines. And they'll say, I had these since I was a kid. I get them from my mom has the same ones. I've had them since I was a teenager. They've always bothered me. But now I'm at a point where I've thought about this. I'm coming in to answer more questions. So often it is things that have always kind of, bugged us.
And would you say people are coming in more so from a place of, I'm doing this as like an additional layer to just feel freaking awesome about myself? Or would you say people are coming in thinking that, if I do this, then I will feel awesome about myself? Does that make sense how I phrase that?
Yeah, it does. I would say most people do it as an adjunct to everything else they do to help themselves feel good.
Mm.
So, in addition to having a nice cut and color, in addition to, dressing nice, exercising, it's all part of their puzzle.
Mm.
I'll just be very honest here. There are a group that aren't doing any of what I just mentioned, and they're relying on this specific thing to make them feel better.
Mm.
When I'm sussing that out and getting more information, these treatments provide us with self-confidence. There is no doubt they are popular treatments. We see them everywhere now, right? I'm not saying they're a magic pill to transform someone into being their best self. It is part of the puzzle.
Mm.
And so when someone is taking care of themselves, nutrition, and they're exercising and they're generally, you know, balanced, well-rounded, happy people, it's amazing. And the other group, I would, it can be delicate conversations explaining what kind of expectations do they have from this treatment. So
Mm.
let's keep our expectations realistic. And I'm very honest with people about what they will achieve or what they should expect from this.
Can you elaborate on that? I think that's a really interesting point that you just made. Having a realistic expectation of what this is going to do for you. What does that mean?
Yeah, so, okay, I'll just use an example. Let's say someone in their late 50s, they have never really been someone that focused on good skincare. There is, a lot of sun damage. They've been physically active, but their skin shows, you know, more signs of age. And so they've thought long and hard. They come in, they see me, and they are on a small budget and they're hoping for the world from one or two areas. And so, yeah, it's my responsibility. I'll say, I'm just concerned with your expectations on this. Then maybe I provide more education. I will, explain why I don't think they're a candidate for a treatment. Maybe think about this a little bit longer. It's really important to have realistic expectations and for whoever the provider is to explain this. These aren't, if someone has, so lots of things, could be a year-long process for us to achieve something.
Really?
If their only concern is frown lines, sure, a little bit of Botox, within a week, you notice it. But if someone comes in and it's more about, jaw lines are kind of all the so popular right now, that's multiple treatments of different things over a long time to achieve that. And someone may not even be a candidate to achieve that. So in, social media, I think it can give people false expectations, false reality of what these are and what someone can achieve themselves. Just because someone's friend can come in, get this amount of product put in, doesn't mean they can. Everyone is
Interesting.
different.
That is so interesting to hear. I remember talking to a friend of mine at one point, and she was like, yeah, I went in to get this Botox done. And my girlfriend had said, mine lasted me 8 months, but it lasted me like 8 weeks. Everybody's body is so different.
Yeah, everybody's body is so different. And like I can say, it doesn't last 8 months. Yes, a product has just come out that it is a longer lasting product. Okay. But up until that product came out, and that's so new, not everyone is using it. You know, it's not going to last anyone 8 months. It just is not. Like, so I'll explain. Well, we know the life of this medication is 3 to 4 months. Oh no, I always get 9 months out of mine. No, you don't. You think that you do.
What does that
But
mean?
so, for example, let's say someone goes to their primary care physician and you need asthma medication. You don't say, oh no, just give me one inhaler. One inhaler typically lasts me 4 years. Your physician is going to dive more into that. How often are you using it? Well, it's probably not even, it's expired after like, it's just not even a realistic thing. Or someone goes in and they need their blood pressure medication refilled and they say, oh no, I don't need that dose. I'm usually just good with half of it. Your physician is going to explain, no, this is the dose that you need for your medical history. And so, but because it's beauty, it can be like almost simplified to people and they feel that they're experts in it because it's in the beauty industry with hair, nails, and it's not though. but that's a tough one. That is a real tough one.
It's tricky. And I'm sure even just like people watching other people on social media, seeing like, oh, this is what they're claiming without knowing, is this a sponsored post that's getting put up? Like, how legit are these details? It's tricky. And then you're giving people this sense of false expectations that this is
Yeah,
going to be the
totally.
reality.
It's like, what product was injected? How much of a dose did they get? Where was it injected? There's so many factors. It is not a black and white thing. It's
Mm.
much more involved than I think than patients really give credit to.
Have you ever found in, seeing different practices, and this is not to talk negatively about other practices, but
Yeah.
have you ever noticed in your experience, are there any people who perform this kind of stuff who are giving numbers of this is what it should be, where it's like this is false, or is it coming more so from the consumer who's posting about it and telling their girlfriends?
Yeah, I would say so somewhere out there, and I mean just out there in the ether, consumers learned I had 25 units injected. So then let's say they go to a different provider. Jolene, I just need 25 units here. That's all I ever get. Well, a the consumer is kind of dictating the dose that they think based on no medical knowledge.
Kettlebell Catalyst, the exercise guide for women to build strength, lean muscle, and self confidence to overcoming limiting beliefs, is a book I wrote for women to be empowered to get started with kettlebells. In this book, not only will you learn the 101 details of hardstyle kettlebell technique, but you will also meet lots of women who were brave enough to try using kettlebells and hear how they transformed both physically and mentally. To buy your copy, visit Amazon or Barnes & Noble today.
Knowledge of these procedures. So then I try to explain, well, actually, Karen, for your specific area, I think you need a larger dose so that you get the longevity that you should with this medication, with this product. And so that just makes me cringe. And that goes back to when I said you don't go to your primary care physician and you need an antibiotic and you debate the dose of the antibiotic you need. Same with this, but for some reason, a lot of consumers have focused on the amount, or I usually just get $200. Well, what's 200? What does that mean to you, Karen? Like, what is a unit? If I ask someone who has no knowledge, training, experience with these products, Colleen, what is a unit of Botox? I don't know. I just know that my friend had this amount and it worked awesome for her. So I'd like to try that. It's, yeah.
It's more nuanced than we might think it is, especially if we have not done it before, is what it sounds like. Is that correct?
Much more, much more. So when you're searching out someone to do these procedures on you, what kind of vibe are you getting from them? Are they being honest with you? Are they educating you? Are they taking time to answer all your questions, talk to you about alternatives to treatment? What are the side effects? What are post-care instructions? What is the name of the product you're actually going to get? I think that all helps to provide people with education so that they don't just undersimplify these treatments and think it is like just going to get a polish change on our nails.
It
It
makes
is
me
not.
think, it makes me think, did you ever watch Nip Tuck when it came out?
Yeah.
It makes me think where it's like, we're going to spend all this money to work with these top people, but it's like, I would like to do it cheaper. So you go to a third world country, you pay a fraction of the price, and then you come back with like a horror story.
Yeah, like this here is not where you want to cut cost. And that's something, so I've been doing this a long time. And I always say to myself, sometimes I say it to people, women would never cheap out on their hair.
Mm,
Often, we have a stylist, we're loyal to our stylists.
yeah.
We really are. Maybe we have someone who specifically cuts, and then maybe we have a specific colorist. Maybe you have someone that does both, and you've been with them for 5 years, 10 years. You travel distances to see them.
Yeah.
But on this, we want to cut cost. It shouldn't be somewhere that you're wanting to be cheap.
I don't know if you can answer this question because I'm sure it changes depending on where you are in the world, but is there like a baseline you should expect to pay at least this amount for some of these really common procedures?
Yes, I'll often say to myself, and again, I'm being very honest here. If, and every region is different, but if someone doesn't have $300 to $500 that they can comfortably part with, I would save up until you have enough money to get the treatment that the provider is recommending you get based on your concerns and you feel comfortable with the treatment plan. That will help the success of it.
And when it comes to injections, this isn't like a one and done. Like you're probably coming back continuously over the rest of your life. In my head, at least as somebody who's never done this, that's what I'm thinking. But is that, can you please give me
You
the
don't have
legit
to, you don't
information?
have to, continue them. I have people who, will come once a year on their birthday for a little bit of Botox and filler, and that's a birthday gift for them. But they're not necessarily married to doing it every 4 to 6 months. I think people return regularly because they like it. They like the how it makes them feel and how they, when we feel good, you present yourself, differently in the world. It's true.
Totally. I think your confidence definitely reflected in how that the outer appearance goes hand in hand with the inner. You know,
Yeah.
on this podcast, we've talked about all of these different areas that make up a dangerous woman as a confident woman. And yes, taking care of our bodies with exercise, nutrition, taking care of our mental health, going into therapy, but also, paying attention to how are we dressing and what we're doing with our hair and taking care of some of these outer layers that I always have, like, anytime stuff like this comes up with my husband, he's always just like, but I don't get it. And I'm like, well, I get it. Like, this stuff just makes me feel better. And if I feel better, I feel like I just put this energy out into the world that's different than if I was feeling self conscious. And, I don't think you can necessarily hide behind makeup or a cute outfit or a cute filter and just be like, I'm confident. I think you need to work on all of these different aspects to become your most confident self. But I think this stuff really does, have a very special and specific part to making up somebody who is truly confident. And I think there's some people who are probably, into like the natural side of things, but I think there's other people who are really into this. And like from my perspective, whatever makes you happy, I think that's great. I support that.
Yeah, I agree. Lip filler. We can all picture bad lips,
Wait, I have to
Too
ask you.
big.
I have to ask you. Kylie Jenner, do you remember that thing that she came out with where you were like sucking, doing like that fishy thing in that little cup to like blow up her lips? Does that actually work? Do you know what I'm
I
talking
don't
about?
I don't see how like physiologically that could
Work?
work. You
Okay.
know,
Okay. All right. I just had to ask. Okay. So lip fillers. People can get like a little lip filler happy.
they can. They really can. So my favorite people to work with are people who this is, like I said, just a nice add on to everything that they're doing, and it makes them feel good. They're doing it for themselves. They're not going overboard. They look great. They feel great. Then the people that can get maybe a little overzealous with a certain area, I if they're like my patient, I don't let them. I'll have a difficult conversation, and that can be an unpopular opinion with them, and perhaps they move on and go somewhere else to someone who is going to provide them with that. But my point is, it's part of the puzzle. It's not one thing that's going to transform you to your best self. Be doing everything to feel good. Therapy makes us feel good, exercise, nutrition. Be doing everything that's just going to help you, I think, even get better results, because if you're glowing in the inside, that's just going to radiate out to the world.
Absolutely. Absolutely. Would you say there's any specific questions or like things you're talking about with your patients before they might request for something kind of extreme? Like, do you ever ask
Yeah, I'll
people like,
ask I'll ask how long have you been thinking about this?
hmm,
What's prompted you to, come in today and want to talk about this? And then I take a long time explaining the procedure, educating them so that the patient can make an informed decision based on everything that I have provided to them.
has there ever been a conversation with a potential patient where you've actually said, actually, this is not for you. I'm not going to help you.
Yes. So if someone wakes up, and let's say it's your birthday, and you wake up and you just phone the nearest clinic that can get you in that day, I won't treat you. These aren't spur of the moment impulse decisions to be made.
Hmm.
Yeah, and that's not popular, with someone. They will often become defensive and turn it back on you. So for example, maybe say, oh, do you not feel qualified to do it? Are you saying you can't do it? And I mean, they're just not happy that I'm saying, no, I'm not going to, you know, give you multiple syringes filler into your face, never having treated you before. When someone comes to me for the first time, I liken it to, this is a first date. We're just getting to know each other. Let's start with like a good consult. Let's answer all your questions. Do you like my style? Do you like the information that I'm giving out? Is this something that is, a nice working relationship with both of us? Maybe we do a little bit of Botox. I'll see you in a couple weeks for your follow-up. How did that go? I'm happy with how it looks. How do you like it? And then maybe we talk about adding on. Maybe we talk about filler, and then I'll explain, okay, this would be the process to that. But you don't just go and expect to have treatment that day, not ever meeting this person before or asking any questions. That's not good.
Any other red flags for somebody who is looking to get this done somewhere where, you know, if you were to go, you would be like, oh my gosh, actually, I'm gonna leave because this is not the vibe.
Yeah. So Where is their space? I'm just going to speak very honest here. Is this someone who pops into a hair salon once a month to offer treatments and you don't know who they are, how to get a hold of them for a follow-up? Huge red flag.
Is that a thing? Is that real?
That's a thing.
No.
Yeah. So you walk into someone's office, immediately, what type of feeling are you getting? Is it clean? Is it professional? Is the receptionist warm and welcoming? Does the provider come out and greet you? Hi, Colleen, I'm Jolene. Nice to meet you. Come on in, have a seat. Are they taking their time answering your questions? If you say, Jolene, I'm only here for a consultation, I'm not planning on any treatment today. How do they respond to that? That's amazing. Let's answer all of your questions. Meaning, do you feel pressured or rushed into having something done? What kind of vibe are you getting? I think that's so, so, so important. The space, is it a dedicated space that's used for cosmetic purposes only with a door that closes? So this is private, confidential, the same as any other medical procedure you would have. The same rules apply. Are there consent forms? Is the provider going through the consent form? Are they explaining side effects? Are they explaining alternatives to the treatment you're asking? Do you have their contact information? Are they having you come back for a follow-up so that they can see your results? I would feel so confident if someone is providing all of what I just mentioned. I would be like, yeah, that sounds what we're supposed to do.
I think that's really helpful to hear, especially, you know, making the comment like, I don't want somebody who's just like going into a salon to do something here or there. I mean, I can't say that's anything I've ever picked up on, but going back to your point earlier, my hairstylist literally works in a one room private space for herself. So I would never even see anybody popping in. But if that's something that's out there, what great information to share with our listeners who are considering doing something like this, to know this is a red flag. This is not the vibe.
Yeah, and like I think someone can have a dedicated space. That's where they practice out of. But like I said, it's a dedicated space. That's where they regularly practice out of. It's not a Botox party where it's
Oh,
just, some random,
wait,
not good.
can you speak on that? Because I've heard of those. I have heard of like women who have Botox parties. Is that a legit thing, or is that just something I
It's
saw?
a legit thing. Someone could probably go on Facebook right now and find a Botox party somewhere in your neighborhood, city, and it's dangerous. It's totally unprofessional. It's unprofessional for whoever is the provider doing that. Totally unprofessional. There's no privacy, there's no confidentiality. Often at these Botox parties, there's alcohol involved. Women are getting together, having fun with their friends. Totally unprofessional.
Can you tell us about the dangers of doing that? I mean, I would
Yeah,
imagine like being under the influence of alcohol, making a decision like this is probably bad. But I would also think getting something done while consuming alcohol might not be the best idea. I don't know. Can you elaborate?
yeah. It's like, would you ever go in to have any type of other medical procedure under the influence of alcohol? No,
No.
that just seems crazy. In a room full of women where there's no privacy, there's no confidentiality, someone comes in for a consultation, we are going through your medical history, we are going through your medications, past medical history, past surgeries.
Might not be something you want to share with the whole
It's not,
world.
it might
Yeah.
not even be something, let's say, it is sometimes friends like to come together to an appointment. Do you want your friend knowing medications that you may be on and why and how long? Someone would go, oh, I'm cool. Oh, I'm cool. She's my best friend. This is still confidential to you.
It seems like you've seen some stuff, Jolene.
I think any injector who's been doing this long enough, oh man, we probably could get together and just, the stories.
I would love to bring you back on for story time. I think all of the women that I've brought on so far, it's so interesting because, every area of health and wellness, I think there's always the consumer who thinks they know more than the expert, but there's a reason the expert is the expert and you're coming to them in the first place. That's wild about the Botox parties. I remember when
Yeah.
Botox, I think back to that whole nip tuck era and just starting to hear about Botox and knowing there were women who were going out and doing this. And to your point, it's something that probably makes a little bit more sense to do privately and probably makes more sense to make sure you are not doing intoxicated.
Oh, I could go on my soapbox all day about this. These are prescription medications we are injecting into your body that are there for extended periods of time. Think about it. Ask questions. Don't rush into it. Be comfortable with your provider. Be comfortable that you can be honest with them, but you can also be open to their honest opinions, recommendations. Then it's going to be great. But if price is your number one concern, I would be concerned as to your level of education and awareness of these treatments.
As we wrap this up, and you just gave so much gold in the end right here, all of these additional things for somebody to be considering, is there one more last point that you would like to drive home for somebody who is considering this?
Think about it. Maybe get a second opinion. Maybe get a third opinion. And you will see who provided you the best education. Who did you have the best feeling with, knowing that's the person I want to work with? I'm trusting their experience, their training, their knowledge. I'm trusting that they have the best interest of that patient.
Thank you, Jolene.
You're welcome.
Thank you for listening to the Dangerous Women podcast. If you had any groundbreaking takeaways from today's episode, please tag us on social at the Dangerous Women podcast. To make sure you never miss an episode, subscribe below.